Right. Then what is not true about conjunctivitis? Keratoconjunctivitis versus conjunctivitis is the difference is infiltration to cornea. Otherwise remaining things are all the true statements. Most common presentation of retinoblastoma. This we discussed many times. What is your answer, doctor? Classical question. Question number 12. Rohit says leukocoria with pseudohypopyon or with strabismus. What do you like to propose? Question number 12. Fahima is supporting strabismus. I thought in early stages, quiescent stage is there, no? There leukocoria and strabismus will be there. Anywhere it is given that pseudohypopyon is the most common? I don't think so. Huh? So leukocoria, commonest feature, squint, convergent, strabismus will be there, nystagmus, they are all the features in the quiescent stage. Most common secondary intraocular tumor in females. Little difficult to guess. So orbital tumors, metastatic tumors to the orbit. We know neuroblastoma, etc. Nobody thought in female orbit may what will come. We know rhabdomyosarcoma, etc. This one's for a pure guess. Question number 13. Everyone is saying endometrium. You like to say? D. That's right. Breast. Most common ocular metastases are breast cancer in women, followed by lung, more commonly in men. Okay. Then regarding myopic degeneration, it is associated with more than 6 diopters or less than 6 diopters? More than 6 diopters. And it leads to retinal detachment due to degeneration. So B is the answer. Any other options? If you remember, just fill up the blanks. Huh? Now, which is the drug which is given subcutaneously? I think a very easy question. Most of you know very well that it is a terbutaline which is given subcutaneously. Where do you see SLE-like reactions? I say in both of them, INH, penicillamine, both of them can cause. I don't know what are the other drugs given. Huh? Sulfonamide was there. Hydralazine was also there. Penicillin was there, not penicillamine. Sure? So in that case, penicillin, penicillamine, examiner want to know the difference whether you know or not. It is as much a difference between pen and pencil. Right. It is a penicillamine as corrected by our student. What are they? Sulfonamides, hydralazine, INH is given, and penicillin was given. Okay. So then penicillin becomes the answer. Okay. So which part of the trial, what type of trial do you want to do to know the maximum tolerated dose? Typically we do the phase 1 trial for that purpose to discover MTD, which is the maximum tolerable dose. Phase 1 trial. And to know the extent, duration, reversibility of the toxicity also is assessed in the phase 1 trial basically. Ritonavir inhibits diazepam, amiodarone, cisapride, all the three, but not phenytoin. I leave all this quickly in the literature given to you. This is a good question in targeted drug design. What is the purpose of it? Basically what is meant by targeted drug design? It is also called smart drug delivery. So that you will deliver the drug in such a manner that it doesn't affect any other part of the body except the one which it is directed to. So that is the reason it is to increase the frequency of the drug and target interaction without any other organ getting interacted is the purpose of a targeted drug delivery. A diabetic patient, black necrotic mass, mucormycosis, classical diabetic ketoacidosis, we give amphotericin B. It carries a very high mortality. What is an orphan drug? Is it a drug taken by orphans? Or by taking the drug somebody become orphan? Or drug which is rarely used? It is the drug used for rare diseases. In fact, those diseases themselves are called orphan diseases. So, Rho kinase inhibitor is what? Phosphodil. What is phosphodil? Basically, whenever a tumor has to metastasize to any other organ, it needs to basically act on the RAS related GTpases. So, phosphodil is one such which will act on this Rho kinases fundamentally to prevent the metastatic potential of the tumor. Vasopressin fundamentally acts on the cortical collecting duct or outer medullary collecting duct, whichever it is, right? Then prolonged post antibiotic effect and concentration dependent killing. What is your answer? You want to say? Penicillin. Penicillin. No, doctor. Okay, let me open it for a quiz. Vijay Rohit says even Nicorandil was given and it also has a Rho kinase inhibitor activity. Is it? I don't know. Yesterday only I got introduced to Rho and phosphodil for this class. So, yeah. Question number 10, give me some confident answer. Penicillin, clean bold. Any other answer? First of all, what is meant by prolonged post-antibiotic effect? The name itself says, sir, एक बार लिए तो कुछ दिनों तक the killing effect of antibiotic will be there. Then what is meant by concentration dependent killing? So basically, some drugs will have MIC, minimum inhibitory, minimum bactericidal, like drugs will be there, no? So that's called concentration dependent. So what are the concentration dependent antimicrobials? Fluoroquinolone, aminoglycoside, amphotericin B, they are all the examples of concentration dependent. They have the MIC, minimum inhibitory concentration, all these issues will be there for these drugs. So, fluoroquinolone, question number 10. Question number 10, fluoroquinolone becomes the correct answer. What is the irreversible step in glycolysis? Is it the same question, doctor? Just tell me. Because all the three are irreversible. They were all given. Is glucose 6 phosphatase is there? There, right? Okay. So, except this D, all the remaining are fundamentally irreversible steps basically. Now, real-time PCR means DNA amplification ke liye it is a technique which is being used as all of you know, which is called suicidal enzyme. Lot of times this question was asked, cyclooxygenase. Everyone will be able to give a parrot-like answer. Now, redox reaction, what is it, which don't participate? I don't know what was the option D, because peroxidase, oxygenase, dehydrogenase, all of them will participate in redox, reduction oxidation reaction. You thought peroxidase? Fourth option. Anybody can help me with the next fourth option? Maybe you can put a post to say what were the missing options. No. Von Geerk may, why there will be ketosis developing? So basically they have a hypoglycemia and a low fat utilization which will promote the ketosis. Oxaloacetate lacking is not the feature. In fact, glucogenic amino acids will break down and release more amount of oxaloacetate whenever a person is having von Geerk. So that's the reason B becomes the answer. Which organ in the body cannot metabolize ketone bodies? What is your answer? Vijay Rohit says hydroperoxidase, not simple peroxidase was given in the exam. Any peroxidase is peroxidase only, no? Huh? Yeah. So question number 16, everyone is answering RBC. Mitochondria is required for using ketone bodies. Anything missing mitochondria doesn't. What is peculiar thing about ketone bodies? My favorite question in every Sunday exam. Only organ in the body which can produce ketone bodies is liver. Only organ in the body which cannot use ketone bodies for itself is liver. What it? Huh? Why liver cannot utilize ketone bodies? Ketone bodies are what, doctor? Acetone, acetoacetate, beta hydroxybutyrate. To use them, how they should be used? They should be reconverted into acetyl CoA and need to be used. For that reconversion, you require an enzyme called thiophorase. That is ketone bodies back to acetyl CoA. Liver doesn't have thiophorase. Liver has all enzymes needed for converting acetyl CoA to acetone, acetoacetate, beta hydroxybutyrate, but not back to the acetyl CoA. Hence, liver can't utilize by itself the ketone bodies. Known genetic loci are identified by using the fish technique. Fluorescence in situ hybridization. Then X size 100 micromicron wide is not a feature of Opisthochis viverni, because Opisthochis viverni has got a 13 to 12 micrometer size small X, not the big X. What is a non-suppurative complication of sore throat? Both glomerulonephritis and acute rheumatic fever, both of them can occur because of the streptococcal sore throat. Whereas with streptococcal skin infection, only glomerulonephritis will occur, but not rheumatic fever. You agree with me? Vice versa. They get rheumatic fever due to skin infections or kidney involvement. Kidney involvement, no? Huh? Then, rapidly growing atypical mycobacteria not involved in lung infection. Was it the same frame? Huh? If it is rapid growing, I prefer Fortutium, not Canaceae. Canaceae can cause TB-like lung infection. Fortutium cannot cause lung infection. So rapid growing, not causing lung infection makes me to favor Fortutium. I don't know why a lot of students preferred question number 20. A good number of our students, they opined it as Canaceae. I don't know why, but it would be Fortutium. Ridley-Jopling classification. पढ़ने के बाद भी अनंत नारायणन को पूरा कलर्स मारने के बाद भी underlines. If you still do questions wrong, means this is a classical example of such a question. What? Ridley-Jopling में one long sentence will be there. Clinical, histological, microbiological and immunological criteria is called Ridley-Jopling. Who will remember? Was it clinical or not, or histological or not, or microbiological or not? Examiner can cluster them and frame a beautiful samosa-like question and can give you in the exam. So, clinical, bacteriological, immunological, histological becomes Ridley-Jopling. But what is the rule? Microbiology top 20 topics में leprosy, high yield topic list में. Most of the times, by the time we go to the chapter of mycobacterium, we lose energy in microbiology textbook. So, we need to be very careful. What is the highest number of questions asked in microbiology? Till now, Streptococcus. Without that, there is no paper. You have also seen a sore throat post sequelae or what? Generally, one question will definitely there on Streptococcus. So, I leave to you the 1250 topic list. So, whenever you open book, try to approach from what is commonly asked. If you don't have energy also, if you finish 50% high yield topics, still you will get 80% score in actual entrance. Legionella, Air conditioners. Standard question. Vaccine for meningococcal meningitis, there are few indications. Immunocompetent people, when do you give? Immunocompromised, when do you give? Blah, blah, blah. So that is all part of the story. Now, doctor, did he load part 6 PPT? Ask him. Without developmental milestones, can you think of pediatrics in any entrance? No, sir. Child can sit by 9 months, not unable to sit. That itself is wrong. Everything else is right. Pins of gas by 9 months, 2 words by meaning by 1 to 1.5 years. They're all correct. But you need to understand, pediatrics open karte hi first half an hour you should spend like Hanuman Chalisa. First developmental milestones, some 30-40 milestones will be there, you have to finish. Now, most common complication of baby less than 1000. Actually, this is a question in ophthalmology. Retinopathy of prematurity, many times we discussed, no? What are the criteria? Less than 1000 grams, 80% babies will develop retinopathy of prematurity. Premature baby with seizures on second day. So basically in pediatrics, answer is transcranial ultrasound. You should know what are the causes of seizures at various ages. So I leave all that literature for you, doctor. 0 to 3 days is due to perinatal asphyxia, intracranial hemorrhage, metabolic and developmental defects. Day 4 to 7 is due to sepsis, meningitis and developmental defects. Hence 0 to 3 May, transcranial ultrasound is the first line of investigation to identify any intracranial hemorrhage or any structural problem. 2-year-old child with solid mass in kidney, right hand is and leg are longer. What is that called? Hemihypertrophy. Hemihypertrophy is a feature of Beckwith-Wiedemann syndrome, where you will also have Wilms tumor. Once more, top 20 topics in the pediatrics list given to you. Wilms invariably is a part of it, right? You can't ignore. Neonatal sepsis. What are the common causes? In fact, all the 4 are the common causes. Who said, was it an except question, doctor? What was there in exam? Any early onset, late onset, something was given? No. All this Klebsiella, E. coli, group B, Streptococcus staph, everything will cause. Right? I don't know what was there in examiner mind. Alright. Rett's disorder. What is the other name given for it, doctor? Cerebroatrophic hyperammonemia is a neurodevelopmental disorder. You have microcephaly with mental retardation, not macrocephaly. Father of neurootology. Complete bouncer. Negative marks are there, no, AIIMS mein. That's the reason this kind of questions are given. Right? Aja bete, aja. If you put in the mouth of the error, then you will be dragged in. William House. Anyway, we need to know few curious things about William House, right? Have you any time gone to dentist? You have a dental chair, no? It was the William House who first said, how come people sit like this and we examine the teeth? It's okay for the lower teeth, not the upper teeth. Hence make the patient to incline and on a reclining chair. He is the one who introduced. Before joining medical school, he was a dentist. Then he joined medical school, then became father of neurootology, father of his children, so many things he did. So that time his naval chief said, no, if you do recline the female patients, you may molest them. There can be chances that your idea is to rape them. So he said, no sir, I want to become father of neurootology. So I have a long way of fathering, I don't want to father any ill fame. So later on, entire world now, 1945 mein he introduced, now everyone. But most important contribution of him is that facial recess approach to the mastoid, middle ear, is the one pioneered by William F. House, who is called father of neuro-otology. Classical question about petrositis, many times asked in the exam. Persistent ear pain, retroorbital pain and mastoidectomy. When a patient presents, in spite of mastoidectomy, you should think of this complication which is petrositis. Now doctor, 3-month history of hearing loss but intact tympanum with fluid behind the tympanic membrane, old guy. Always you should think of nasopharyngeal carcinoma and you need to evaluate. It presents like a serous otitis media in an elderly person. Generally in a child, if you find serous, non-suppurative serous otitis media, it is okay. Elderly person means you should think of nasopharyngeal carcinoma. Now, which is a complete cartilage? Super. Cricoid is the only complete cartilage. What are the boundaries of facial recess? I think examiner is biased about Houston. Who is that? Father of? Please help me. What? William? House? House. Okay. He is also favoritely called by everyone as Bill. So facial recess is a favorite area for the examiner. So in fact all these three, Dr. Incus, chordae tympani, facial nerve. Medial is facial nerve, lateral is chordae tympani, superior is incus buttress. I don't know what was fourth option. 75-year-old granulation tissue with facial nerve palsy. What else? Malignant otitis externa. Many times asked in the exam. In a diabetic patient. Left-sided ear discharge, but a normal tympanic membrane with a posterior canal wall dehiscence. Normal tympanic membrane rules out the possibility of otitis media or otitis media or cholesteatoma. So that makes keratosis obturans as the answer, where typically tympanic membrane will be normal in appearance. Thumb sign on X-ray, many times we discussed. In epiglottitis, that edematous epiglottis looks like a thumb sign. Child with laryngotracheobronchitis, well hydrated, feeding well, consolable, what is the treatment? We give dexamethasone. Typically they are known to improve the outcome with all kinds of severity. If you give it within about as early as 6 hours after administration, there is a significant relief. One staging of American Journal of Cancer Society, you must be lucky enough that time to remember what is right, what is wrong. Anyway, basically T0 means no evidence of primary tumor as in this case. M0 means there is no metastasis. N2A means more than 3 but not more than 6. Is the typical American Journal, American College criteria. Who is the ideal patient for BAHA? What is BAHA? One question on hearing loss and hearing aids, cochlear implants will definitely be there. So BAHA is a unique implantable device, bone anchored hearing appliance, which is classically used whenever the patient is having bilateral microtia and auditory canal atresia. A girl coming with kerosene like odor anytime as a casualty, have you seen the OP poisoning case? It will be a kerosene like odor. You will be thinking, did she consume kerosene or OP? OP smells like kerosene. Lacrimation, blah blah blah. Will atropine reverse neuromuscular weakness? Atropine acts on muscarinic receptors. In neuromuscular junction, who is there? Nicotinic receptors. So it has no effect on the neuromuscular weakness basically. Then doctor, he created PPT 6 is there? 1 minute. Yeah. You transfer that file. This another common question, fracture a signature fracture. What is it a type of? It is a type of depressed fracture, as all of you know very well. It is caused by a heavy weapon with a small striking surface like hammer, and the fractured bone becomes depressed inwards, and its shapes basically indicates the type of the weapon used. Hence, it is making a signature. Fracture a la signature. Now, inability to identify entry and exit wounds due to a surgical alteration is called what phenomena? Kennedy phenomena. So, what are the other questions which can come? Pappu rule, Puppy's rule, whatever. The rule is applicable to any multiple blunt force causing skull fracture or multiple bullets struck the head causing injury. To determine the sequence of application of the force or shot is called Puppy's rule, which can come in AIIMS November 2013. Kennedy phenomena is already said. Bullet embolism. Whenever the bullet enters and lodged into a large blood vessel and acts like an embolus, you call bullet embolism. What is Wechsler scale? IQ. What is meant by average? 90 to 109 is average, hence answer becomes 90. What is the anti-craving drug in alcohol intoxication? Basically, we use naltrexone. Lot of times this question was repeated in AIIMS regularly. Naltrexone. Already we said alcohol withdrawal and rum fits is because of. Is this question also there? Earlier that was also there. What after fever he developed procedures and he is a regular alcoholic. Both are there. That means alcohol withdrawal is that important, of national importance. Alcohol withdrawal syndrome is benzodiazepine. Normal and lesional disease, lesional brain, diseased brain. If you study the brain and behavior, what do you call it as? You call it as neuropsychology. So basically, lesion studies in humans and animals, you basically conduct. Dysphoria is caused by the kappa type of opioid receptors basically. Acute pyelonephritis, how do you recognize? Basically, it is the hypoechoic lesions and also actually enlargement. This enlargement was also there in the options. Actually, it causes both enlargement and hypoechoic lesions, but I don't know. Hypoechoic is more likely to be an answer. T2 weighted hypoechoic lesions in liver and lower pole of kidney means hemangiomas, which are typical of von Hippel-Lindau. Mental retardation with rhabdomyoma of liver and kidney makes the one neurocutaneous syndrome is common, doctor. Tuberous sclerosis, Huge Weber, and neurofibromatosis, anything can come. So tuberous sclerosis, what is the classical triad? Epilepsy, mental retardation and adenoma sebaceum is the classical triad. There is a wrist stiffness, shiny skin, diffuse calcification. What will you think? Sudex atrophy, classical. Sympathetic dystrophy, so otherwise. Osteoblastic metastasis, where do you see? So basically, kidney, thyroid are lytic, doctor. Breast, lung are mixed. Prostate, medulloblastoma, bronchial consonant are purely blastic. So breast being there, breast becomes the answer, which can be actually mixed, both lytic and also blastic. Limb shortening, abduction and external rotation, where do you see? So what is the type of posturing in posterior hip dislocation? You are having shortening, flexion, internal rotation. Anterior dislocation you have lengthening, abduction and external rotation. But what was given? Shortening and abduction was given, right? So either abduction or adduction, anything can happen. Internal or external, any rotation can happen in central. But the leg is shortened. Hence answer becomes central dislocation. Then last but not the least, can you give the next PPT? Prostate was given, breast was also given, it was not there, no? Then prostate becomes answer, okay, no problem. But about 70% paper is predictable, highly predictable. If you prepared TODA 4-5 months, if you give time for the high yield topics and ignore Facebook with the fiancé, then you can definitely crack the exam. Or you make fiancé also read with you, both of you can join in, one anesthetist, other become gynecologist, good combination. Right, this is the same. I finished in the PPT, all questions are over. Okay, how many we finished totally? 156 questions. Okay, doctor, that brings the end of this marathon 3-hour session on AIIMS paper. We will host it tonight on YouTube, all this video. Then there are some 35-40 questions in typical statistics and SPM and all that. So I could not get the complete length of the question for me to discuss, and few questions were all half recalled. But anyway, 156 is a good number in AIIMS. After PGI paper is over, we will also discuss the PGI. So I wish you all good luck, and I think now the things are more clear. Counseling, everything for those who took entrance last year, and those who already are aspiring for next year, you can be quite clear whether the exam is there in November or February or March. You better wake up, arise and run and reach and finish 1200 topics. That's the only way that you can survive the exam. Thank you.